Unborn ordinance, which is to be finalized tomorrow. We also have concerns about the ordinance itself and the chilling effect that it might have on the physician-patient relationship, but we will address these concerns later. Today I'm focusing on the potentially misleading language. We are concerned about the following portion of the proposed ballot language. Quote, all caps, declaring that abortion at all times and at all stages of pregnancy is unlawful unless an abortion is performed to save the life of a pregnant woman in a medical emergency. Reading this, you might think this ordinance is about the legality of abortion. Maybe you think, I'm pro-life, I guess I should vote in favor. Well, many of the physician members of our board are also pro-life, but they strongly oppose this ordinance. It's not about outlawing abortions in Amarillo. Elective abortions are already illegal in the state of Texas. Elective abortions have never, to our knowledge, been performed in the city of Amarillo. Declaring abortions illegal is a moot point. This ordinance is really about giving any aid, even emotional support, to a woman who is considering abortion. It interposes the city government and the legal system between a patient and her doctor. And what might happen if anyone, not just the woman herself, but anybody, suspects the doctor of advocating for abortion? They take the doctor to court. And if sued, doctors are limited by federal HIPAA laws from fully defending themselves. We fear that this threat will poison the relationship between doctor and patient at a time when honesty and confidentiality are most important. The board also objects to the use of the word trafficking in the ordinance. We deal with human trafficking more than we wish. I've spoken at many seminars and conferences about trafficking, and human trafficking is a serious crime. But the definition of trafficking says that it requires fraud, force, or coercion. What are we really talking about here? We're talking about the mother who offers to drive her daughter to New Mexico. We're talking about the grandfather who is, quote, complicit by giving his granddaughter gas money to get to Colorado. We're talking about anyone, a friend, a minister, a counselor who, quote, aids and abets the abortion just by providing emotional support. This is not trafficking in any sense of the word that we would recognize. We feel that the less prejudicial term for this activity is transporting. Again, the board of the Potter-Randall County Medical Society is concerned about the ordinance as a whole. We understand why the City Council voted 4-1 not to approve it, and we will carry on with our educational campaign. Right now, we just want the ballot language to reflect the content and purpose of the ordinance in clear and honest language. Questions?
When you talk about trafficking, I mean that's a very powerful term.
It's a loaded term.
So, what do you feel like this is being basically deceptive to the people that are voting, and that by using this term or even the long language that describes the 18-page ordinance, is this very? I mean, what is more of the problems? Not just with what you've said, but what are more of the problems with that?
Well, this obviously makes people think of human sex trafficking, right? It makes you think of women who are kidnapped, held against their will, and forced into prostitution. That's not what we're talking about here. We're talking about a woman going to New Mexico to get an abortion. If anybody helps, they say aids and abets, anybody helps her in any way in this enterprise, this ordinance speaks to them. So we think it's too broad. We think the use of the word trafficking puts a false slant on the ordinance, and we oppose that word.
And I know Mark Lee Dixon has stated that this word applies. Have you seen any legal definitions that have applied trafficking in this manner?
Well, he uses trafficking in relationship to the fetus, okay? And we must be honest about that. That's what he's talking about. We just want people to understand what the implications of this ordinance would be. This is a travel ban. Some people don't like to use that word. If a woman is traveling from Hollis, Oklahoma to New Mexico to get an abortion and passes through Amarillo, anybody who is helping her is susceptible to being sued. Okay, so we think that this is way too broad. We think it's not truly trafficking for a mother to drive her daughter to New Mexico, and we don't think the city has a lot to do. City and the court system has a lot to do, and we don't think it's right to gum up the system with these kind of cases.
We've heard a lot of rumblings about how these sort of laws and this, focus on us is affecting the medical community. That maybe, we're having a hard time attracting doctors. Could you speak a little bit to that?
I don't know the statistics, but I know that certain states that have had laws like this in the past have had an exodus of OB-GYN doctors. The state of Idaho comes to mind. I don't know whether that started to happen in the state of Texas, but it's a risk. Another problem is the statute says that it's not illegal for a doctor to prepare themselves to perform the abortion. And this would be in case of a emergency for the mother. How do you prepare yourself for an abortion? How do you know how to do an abortion if you haven't had training in that? Now, there are plenty of legal ways to accomplish that, but they're very limited. As you may know, the state law is extremely restrictive in terms of emergency abortions. So, the training of young doctors, the training of residents in OB-GYN is a problem. Residencies that, programs that train residencies in the state of Texas have already had difficulty recruiting new applicants to their program. So I don't know the statistics. I know that that's a potential risk that we're concerned about.
Do you believe this ordinance would put women at risk?
Yes. There are aspects of the state law itself that are problematic in that regard. As you know, that's been adjudicated. But this adds on, this piles on. This not only, now, you have to be clear about this. The woman herself is not liable to suit. You can't sue the woman. You can't say, I know that Jean went to New Mexico to get an abortion. I think that's wrong. I'm going to sue Jean. That does not happen. But anybody who supports her mother, if her mother supports her mother provides emotional support. Her mother is at risk of being sued. So I think that's going to limit what the woman chooses to do. I think that's going to limit, the options that she has. So in emergency situations, that may be a problem. That may be a problem in other situations as well.
Now, you brought up this was going to put a strain between a patient and a doctor's relationship.
Right.
How is that going to put a strain on it?
The ordinance says that truthful information being imparted in a medical setting is not prohibited. What's truthful information? It looks different to one side than the other side. Let's say a woman asks me about the relative safety between elective abortion and having a baby, a vaginal delivery. Elective abortion is 20 to 30 times safer in terms of maternal mortality than abortion. Abortion is safer than vaginal delivery. If I give her that, what I would consider factual information, what I would consider truthful information, am I influencing her to have an abortion? If she's on the fence and she thinks, well, it would be risky to carry this baby to full term. The risk would be quite a bit higher, and that would affect her judgment. Then somebody could come and sue me, say, Dr. Urban, you told that information in a way that that encourage the woman to terminate the pregnancy. We are prevented, it specifically refers to abortion doula services in here, and it tells all the things that somebody who's helping a woman with abortion cannot do, okay? And one of them is to provide emotional support. We in medicine provide emotional support all the time. If I have somebody that disagrees with my recommendations and does something that I disagree with, I'm still going to give that person emotional support. I'll say, I understand this is a difficult decision, and I'm going to support you even if you don't agree with my decision. We may not be able to do that with our patients. So in subtle ways, it's getting in between the doctor and the patient, and what, again, should be honesty and confidentiality should be supreme in that circumstance. Just put yourself in the situation. To have this pall hanging over our heads that we may be sued if we say the wrong word, that poisons the water.
Since we're with 7, I'll be finished with 7. What would you tell someone who is faced with the decision that they have to drive their loved one to New Mexico or Colorado for an abortion?
I don't know what I would say. Let me put myself in that situation. I had 2 daughters. Fortunately, I never had to deal with this. But what if my daughter came back from Rice University, where she went to college, and said, Dad, I'm pregnant. And I say, how did this happen? And she says, I was raped. Okay? And I've never advocated for abortion in my 40 years of practice. I have never told a woman that she should have an abortion. That's partly because I'm an internist and didn't come up that often, but that's my personal belief. But what if she says, listens to everything I have to say and says, Dad, I don't agree with you. I cannot carry this pregnancy to term. Who knows what kind of child it's going to be? Who knows the consequences of that? Who knows what life? Well, I might disagree with that choice, but would I provide emotional support to my daughter? I don't know. That'd be a tough call. Would I give her money to drive to New Mexico? Would I let my wife drive her to New Mexico? I don't know. That would be a tough call. I might help my daughter in that circumstance, even though I have real personal reservations about abortion.
And our understanding is the language of the proposed ordinance cannot be changed. So it must be on the ballot as it is. What would your advice be to voters if no changes are made?
I didn't know that. I thought they were going to consider the possible language change at tomorrow's meeting. But
I believe it's the language on the ballot itself, not the ordinance.
right, the language of the ordinance cannot be changed. The purpose of the ballot language is to accurately reflect what is in the ordinance. Not very many people are going to read that whole 17-page ordinance. I've read it many times. It is pretty boring. Okay, so they're going to look to that as a fair representation of what they're voting for. And that's what we're concerned about right now. We're concerned about the ballot language. Yeah, we're concerned about that ordinance. I got lots of things to say about that ordinance. But right now, our major concern is just fair and adequate representation of what's really in that ordinance.
How would you like to see that language represented? Like what's your ideal version of that ballot language?
I would have the part about abortion being illegal in Amarillo to be, that's not really what they're talking about at all. Now, you've read the ordinance, you know, they talk about everything. They talk about the definition of a woman. They talk about, transgendered issues in there. They talk about a million things. They talk about district attorneys in Houston should prosecute this. So there are a million things in there. But the crux of it is not making abortion illegal. Okay? That's what people may think. I don't think abortion should be legal in Amarillo. That's not what this is about. This is about all those prohibitions against helping, against aiding people, against having abortion drugs in your presence. It's about 100 different things. But we want people just to understand that it's not about making abortion illegal. That's already been done. So I would start with what it's all about. I would expunge that segment, and then I would change the word trafficking to transporting, okay? Or a traffic ban or some other. I just think that would be less prejudicial language to use when a person is trying to think of what am I voting about or trafficking. Oh, that sounds bad. Well, I told you what it really represents, and I think people just need to adequately, fairly understand what they're voting for.
I wanted to bounce off the Tribune's earlier question. Could you share any sort of personal voices that you hear among your colleagues within the medical society about, are we all collectively concerned with this, and exactly what you keep hearing coming up with those concerns?
I can't speak to that as much as you would like. I know what the Board of the Medical Society is basically unanimous in opposing the ordinance itself. And again, we have many pro-life doctors on that board that say, I'm pro-life, but, okay? So I think even pro-life doctors are concerned how this is going to affect their ability to interact with their patients. I know that the OB-GYN doctors have some concerns about the emergency and when it's an emergency and when it's done to save the life of the mother or to help her health. I know that there are issues about that, but I really can't speak to that. It's that kind of out of my area.
The organizations that are pushing this have stated over and over they feel like abortion is murder. But within these ordinances, they are treating the woman that is getting the abortion like she has no agency in the decision. What are your kind of thoughts on that? Because we're not even criminalize abortion. We're basically, if you get an abortion or if you help a person get an abortion, you're basically going to pay a fine. So what are your kind of thoughts on the lack of agency they are stating that women have in a supposed murdering of a child?
Well, I would just go back to the scenario that I gave you a little bit earlier about thinking with my daughter if she said had unwanted pregnancy. She's going to make that call, and I'm going to respect her judgment. We all know that abortion is a fraught issue. We all know that you can look at it from many different angles, and I don't want to say that this is about abortion. Okay, that's your own personal decision to make, and it's governed by the state law, the law of the state in which you live. I just think it's a difficult decision, and I do think that this would threaten a woman who's making the decision for abortion, right? This would threaten, if your mother helps you in any way, I'm coming after you. And of course, that's not to say anything about the possibility of frivolous lawsuits of, chance to make $1 million. Well, it may not be $1 million, but it's more than 100,000. I mean, more than 10,000. So it could be a lot. That's to say nothing of frivolous activity, but the net effect, I think, is to demean the woman in her choice.
Do you know of any other circumstances when you talk about aiding and abetting? Like if I take somebody to Oklahoma to gamble, which is legal in Oklahoma, do you know of any other instances where laws are passed where you go somewhere where something's legal, but you get punished by a state that you did not do this in? Do you know of any circumstances?
Well, I'm no lawyer, but that doesn't sound constitutional to me. And I know, listen, I've been to New Mexico to play a few hands of poker, and I know that that's not illegal to do. So strikes me as pretty unprecedented. I just read that Clarendon looked at this ordinance and voted it down. Their city council voted it down. Clarendon is a pretty darn conservative community, and their people looked at this and decided, I bet 80% of people in Clarendon are pro-life, but they said this is way more than abortion.
I have a question. So you said that this is also threatening against a woman, but how do you see it as a medical professional? Isn't this threatening towards y'all as well?
Well, that's what I was talking about really at the very first part of it, that I think it poisons the water in terms of the free communication between doctor and patient. Let's say the woman knows about this law. She may be reluctant even to talk to her doctor about it. She may think, oh, I could get my doctor in trouble if I just talk about it. Or maybe he'll give me a website, or maybe he'll say, oh, I heard that such and such a clinic in Albuquerque is safe and they do a good job. Okay, that could be aiding and abetting. So she may be reluctant even to bring up the issue. Okay, well that's bad for patient care. Okay, I want to be able to help my patient in whatever circumstance. I want her to be able. Listen, they've told me a lot of things over the years, and I think they should just not have the feeling that the civil lawsuit system is weighing over their head when they talk to their doctor. So I think that's really the great risk from a professional standpoint.
You mentioned briefly about the possibility for frivolous lawsuits. Are there any scenarios you believe that under this ordinance, people that unknowingly assist or even aren't assisting in transporting for abortion or aiding and abetting, as the ordinance claims, could be targeted for lawsuit?
I don't know of anything. Of course, this ordinance has not been enacted yet, but I could imagine that, let's say the woman has a difficult time deciding. She talks to lots of people about that. She decides to go ahead and have an abortion. 9 months later, she has regret about that decision, and that happens. We know that. That's talked about a lot in this ordinance. But then she starts thinking, who was responsible for me making this decision? And then her aunt comes along and says, we could make money out of this deal, right? We could, and the doctor really can't adequately defend themselves, so we could take this to court. We could sue for a couple of $100,000, and so I could imagine that scenario happening. Whether it has ever happened, I don't know, but it could. You think nobody really files frivolous lawsuits. That's kind of an imaginary thing. That's not an imaginary thing. That happens. People do that.
I would like to ask my final question about, it just slipped my mind. Essentially, the corrosion between, you had spoken about the corrosion between the patient and doctor relationship. Could you speak about how you could also imagine the corrosion between a familial unit if, let's say, the aunt, again, persecutes whoever helped the daughter, and how that could divide within a familial support unit?
Stetson, the use of the word corrosion is a great way to look at this. And sure, I could imagine if there is disagreement in the family, if there's, the aunt or the father disagrees with the daughter's decision, the mother supports the father, goes about that, I could think that would be very disruptive to the family. Listen, it would be very disruptive to, I think, my daughter's emotional health if I said, I can't have anything to do with this. I can't give you emotional support. You're no child of mine. Get out of my house. Okay? I would never do such a thing. I think that would be horrible. And to have your theoretical beliefs that abortion is murder overcome the pain and the need of your daughter right before you, I couldn't do it.
Do you think this will increase home abortions or back-alley abortions?
The great risk, of course, no, I don't think this will do that, because I think the state law does that. So, and we have to understand that this is not an ordinance to outlaw abortion. Okay, but I know people who practiced medicine back in the days where what we call septic abortions came in. The mother often in sepsis often died. The baby always died, and it apparently was a horrific situation. I've never experienced that. It's not been in my practice, but of course that's the fear. Now, when a flu epidemic comes out, we always think the worst, it could be 1918 and 100 million people die, maybe it wouldn't be that bad. But before abortion was accessible, that was a real problem.
One more. So with the Texas law, we've seen, you know, I think a lot of people think about abortion and think it's just young women using it as birth control, but there are also medical instances where, you know, a woman gets later into the pregnancy and, you know, something needs to happen or she miscarries and that, you know, DNC is a part of that process.
Mhm.
We've seen a reluctance in doctors in some cases to treat that further. Do you feel like this ordinance would increase that reluctance potentially for women in that situation?
Couldn't help it right now. That, again, I think the state law is the primary driver in that, but of course it's going to make you think, yeah, this is a borderline decision. I'm not sure what to do. This pregnancy condition increases the woman's risk of dying from this pregnancy, but it doesn't ensure that that's going to happen. Maybe it increases it by 10% or 50%. You know, you're in that decision where it's difficult to know if this is, according to the state law, justified abortion or not. So I could think it would only make that worse.
Good? Everybody good?
Thanks, guys.
This was not a question for camera, but,
You might wanna wait until I'm ready.
Yeah.
well, no, this is not gonna be controversial.